Hi, my name's Mary Kramer, and I wanted to talk to you about the PDMP Perfection meeting in the House of Representatives in the state of Missouri in 2020. I heard a lot of different things, and I wanted to address them, and I hope you watch this video through to the end. There's a lot of things. I normally don't write things down and look at them a lot. I like to speak from the heart, but this time I'm going to be looking down at my paper. A PDMP will not stop addiction. You are throwing a dart at a target, and it's not even hitting the board. I want to address the issues I've heard in the PDMP Perfection, and I hope that you will listen. I also want to preface this video by saying that when I comment about pain patients, I'm referring to every condition that requires medication listed in the PDMP, like medications for muscle relaxants, depression, anxiety, ADHD, and testosterone. My name is Mary Kramer. I am a chronic pain patient with multiple conditions with no cure. I've had 3 brain surgeries, and this is a photo of me after one of them with my staples in my head. I've had 2 spine surgeries. I have a baseline hereditary condition that my kids have. I have a child with type 1 diabetes, and I have a child that plans to be a doctor. I work full time. I am a mom, and I'm married. I want the right to continue to have the freedom to meet with my doctors and make plans to help my conditions and my children's. But that right is almost gone. Let me explain what pain patients and patients using the other medications in the PDMP endure. Number 1, we have multiple doctors. People with complex conditions have multiple doctors. So the pain patient amendment is not sending patients to get another new doctor's opinion. We already have broken healthcare into specialties. So many of us are complex and we're seeing lots of doctors. For example, a lot of us have a primary care doctor. We might have other doctors like a neurologist, a gastroenterologist, all different kinds of things. People see many doctors. If you're having surgery, that surgeon could also be another doctor. So we're already seeing many doctors. Number 2, pain patients are drug tested. The multiple theory of patients using tobacco, alcohol, marijuana, etc. means that if they go to a doctor for opioids and they find marijuana or other drugs show up in their system, they will not get a prescription for drugs. Legal prescriptions are not in the line of progression of drugs because addicts know this and are already hitting the streets. That is why deaths are rising. Doctors won't catch these people. Number 3, pain patients already have had doctors told by their employers, their hospital groups, their liability insurance, patient insurance, pharmacies, and government telling them what to do. So their doctors have many intrusions already on their time. Doctors all over the country have been arrested and jailed by the DEA. The doctors are scared. Without doctors being able to prescribe with confidence, they will not prescribe. That is why a waiver that a patient would sign would not only inform the patient of what they're getting, but would allow doctors, then their employers, their hospital groups, their liability insurance groups, pharmacies, etc., insurance companies, to allow doctors to be doctors. Do you realize that we sign waivers for surgeries and treatments? We already sign waivers. That's how things get done. But right now, there is no disclosure even given to people that are entering the St. Louis County PDMP. There is none. Also, the PDMP can be used in other ways. In one doctor's trial, the PDMP in Alabama was used and cited for the prescribing practices of the doctor. So, the PDMP that's supposed to be so useful to doctors can actually harm them. Number 4, we already have complex patients in Missouri that not only lost their pain meds from doctors being pressured, that they no longer have any care at all. We have complex patients with no doctor. A study surveyed doctors and found that 81% of doctors are reluctant to take on new patients currently taking opioids, despite the fact that 83% admit it has made it difficult to treat patients suffering from chronic pain. These patients have lost care, have 4 options. So when a patient loses care, I can see 4 options. 1, they can try to survive without any medication. But untreated pain causes additional health problems. And we had several people with chronic pain that had heart attacks this week. They can try over-the-counter meds. That's another option. But how many of them know the maximum daily dose on some of those, especially Tylenol? If you take too much of these meds, you can overdose. And you can also, if you don't overdose, create long-term damage to your body. The 3rd option is illegal drugs. And the 4th option is suicide. I do not know any pain patient without a suicide plan. I get texts and messages and calls multiple times a week about patients that have had their meds reduced or cut, and some of them that are contemplating suicide. Number 5, when a pain patient in Missouri is falsely flagged for pharmacy or doctor shopping, there is no notification sent to the patient. The flag lasts for 6 months. Even if an error is found, it cannot be removed, and St. Louis County knows the system is flawed. Here's an example of a patient in Missouri. A pain patient had a cost of care of $120 a month and saw the doctor twice a year and worked full-time. The pain patient had an emergency surgery. The patient told the doctors what meds they were on. When they left the hospital with additional meds that the patient was given by the surgeon. So they now had another doctor and got meds from another pharmacy. So that the patient was flagged for doctor and pharmacy shopping and given no notice. Along the way, the regular doctor did not want to prescribe opioids anymore and wanted the patient to seek pain management. And the patient tried to seek pain management, but every time the appointment got near, the appointment was canceled. And a referral was finally made from the doctor to a pain management doctor. The patient went in, met with the pain management doctor, and when the pain management doctor saw that the patient was flagged, they said that normally the patient is not accepted. But the doctor liked the patient and said that they had to do a lot of work before they were even allowed to treat them. So it's not as simple as what was presented during the PDMP Perfection meeting, is what the doctor can query the system and decide if they want to prescribe or not. That's not how this works. The doctors have to do a lot of work on their end. Remember, they still have employers and they have liability insurance, so they have to document. Again, the patient's cost of care is now $4,200 a month. They see a pain management doctor 2 to 3 times a month instead before where they were seeing a doctor twice a year. They can no longer work. The cost of care again went from $120 a month to $4,200 a month that we pay for because the patient can no longer work, and the patient also receives disability. They are also in more pain because the new meds do not work as well. The new meds are more expensive. They are more addictive. They have more side effects and they're less effective. And you're talking about the whole cost of what this causes. It causes this additional cost on the state of Missouri, but it also has additional costs for the patient. When patients are able to work, they feel valued. And so you need to look at the whole picture. Number 6, pain patients also do many things. We consider pain meds as part of our toolbox. The toolbox was brought up at the PDMP, that was going to be a toolbox. Well, patients have their own toolbox. We have ointments and oils and braces and ice and heat and therapy, etc. When pain patients take meds, we want to achieve the best control that makes it so the pain is tolerable, but yet we are functioning. Many are at their best when the pain is reduced. Many of us still have constant pain, but it allows the thought process to happen when you're in reduced pain. Living in constant pain is exhausting. As Representative Rader brings up what kids say when they want to grow up, what they want to be, they don't want to be addicts. Well, when you ask us, no one would say that they would want to be a chronic pain patient either. We did nothing wrong. We want to function, and we want the doctor-patient relationship restored. Here's some other thoughts I have on the Perfection meeting. We do not have a prescription drug epidemic. We have an illegal drug problem that is enhanced by the illegal fentanyl, which is different than the prescription form fentanyl that keeps finding its way into this country. Supply demand is the driver. Also, you must understand that people do not hit the streets asking for fentanyl. They want someone else's prescription meds, so they buy what looks like a prescription med, like Representative Hill said. It's actually a drug that was mixed, but not in a lab, but sometimes in a milk jug, and is pressed into a pill press that I can buy online right now. The person buying the pill hopes that it's okay, and I can bet that if we removed every legal prescription med, that people would still find a way to get high if they wanted to. I asked a recovering addict if they thought most addicts knew about the drug testing doctors do now, and if they thought addicts would seek pain meds. They said if they didn't, they would only go once. Right there is your answer on why a PDMP won't work. Addicts will figure this out and they'll go to the streets. I want to remind everyone that House Bill 1693, the PDMP bill that's currently in form, has no purge. House Bill 188, that was last year's, had a purge built in. I don't recall that being brought up in the PDMP Perfection meeting. I want to address Representative Rader on Executive Order 17-18. It was created by Governor Greitens when the PDMP failed to pass. The manner in which he used an executive order for this purpose was not what the executive order system was designed for. Governor Greitens went to media and he talked about letters that were being sent out to doctors. 8,000 letters were sent out to about half the doctors in the state, which the letters were confusing and the whole situation was confusing. Doctors were scared. because some doctors in practice for 20 plus years said they had never seen anything like this before. Yes, the letters went out by Department Health and Senior Services, and after the 8,000 letters, 2 other groupings of letters were sent out to a smaller number of doctors specifically mentioning patients' information and asked them why they were prescribing such high doses to those patients. These patients were on the MoMedNet system. Big Brother was watching. Doctors knew. Executive Order 17-18 is the only reason the St. Louis County PDMP could start a program. So you opened up a system putting fear into doctors' practices. The government just started their overreach in Missouri. This is the information that the St. Louis County PDMP stores in their for their data and much more. ID numbers like Social Security numbers, patient's full name, prefix like such as Mr. or Dr., suffix, address, the full address, phone number, date of birth, gender, species, human or animal, location like home, nursing home, apartment, stats of the RX, the prescription number, the date written, the refills authorized, the date filled, the refill number, the product ID qualifier, the product ID, the quantity dispensed, the day's supplies, drug dosage units, transmission form of the prescription, partial fill indicator, pharmacy and pharmacy codes, type of payment, private insurance, Medicare, military, etc., date sold, and other pharmacy codes. Okay, so imagine if a person wanting access to drugs was able to see this information. They could target their victim. Imagine an older lady, perhaps your mom, that lives in an expensive retirement community, is widowed, has private insurance, and they can see where she lives, etc. Knowing that pharmacies have cameras, what if they just went straight to the victim's home after the fill date and picked up their meds and a few other things? Would you want your mom in the PDMP? If there is a data breach in the county system right now, who is liable? Is it the county? Is it the state, since Executive Order 17-18 allowed it to form? By the way, did you know that we were interstate data sharing right now? Our county systems hold data from other states like Illinois, Kansas, and Oklahoma, and possibly more, and they hold our information. How is this even possible? The government takes our data, no disclosure, uses it as it wants to, gives our information to who it wants to? That didn't come up in the PDMP Perfection meeting. Also, 30% increase in drug deaths in St. Louis County area in 2018 when the program was started in April of 2017. And you want to save lives, right? That was brought up in the Perfection meeting, but I think it's an important information, so I wanted to bring it up again. You know, prohibition didn't work either. Representative Rader said 85% of heroin users started from prescription meds. The question is, whose prescriptions were they? What I read was that most of the time it's stolen or maybe purchased from family and friends. I'm going to throw out another statistic. The rate of addiction of chronic pain patients to opioids is about 1%. One representative said that if patients sign disclosures, it may muddy the water for future state lawsuits on pharmaceuticals. Really? So block access for pain patients at a chance for the state to sue for money. Are you kidding me? My question is, if a patient is in an awful accident and goes to a trauma center, if they are in the flagged in the PDMP, do they just get no pain med? No relief. And if someone was in prison for a drug-related issue, are they going into the PDMP? Representative Morris, since when are people who are testifying in a hearing about a bill required to offer a solution to a problem when a body of government officials haven't figured out how to do this? He asked that during the insurance hearing when people were testifying. I didn't know I was supposed to come prepared with a solution to the problem that no one at the state has been able to come up with for years. And then he also said it again during the PDMP Perfection meeting. Addiction is more than progression of tobacco, alcohol, and drugs. It can be from multiple reasons, like mental health, physical health, social isolation, stress, and some other inherited traits. Address the addiction problems. We do not have very much help when it comes to these reasons for addiction. We do not have good mental health sources, and that's a known factor for many problems. So, why are we punishing ones that have been doing things right? I had to fight the healthcare system for a diagnosis and treatment, and now I'm fighting the government for my civil liberty rights to treatment. The doctor-patient relationship needs to be restored. We are all different. We all have different body types, tolerance to pain, allergies to meds, we metabolize things different, etc. You also cannot put labels on what conditions constitutes what meds for treatments. That's why we go to our doctors. They know us best. I want the government out of my doctor's office. Doctors have so many intrusions that when I was sick, I had visited with many doctors, and it wasn't a doctor that discovered my condition, it was my 14-year-old child. And then that was taken to a medical doctor and was confirmed. Doctors don't have the time to spend with patients that they need to because of so many intrusions, and we're wanting to place more intrusions on them. I want to thank Representative Mike Moon. Mike has helped me with a lot of things and has given support to chronic pain patients, and I want to thank him immensely. And I want to thank Tom Hurst for also, both of them they attempted to make and lay the foundation to help pain patients with the Pain Patient Amendment. That was an idea presented by and helped with by a chronic pain patient. I also want to thank Representative Hill for attempting a sunset amendment. Again, we have a PDMP Perfection that has no amendment. Please know that most people are not born into this world and leave this world without an accident, need for surgery, or develop a painful condition before they exit this world. If you vote for this bill, remember when the day comes that you or a loved one cannot have access to pain meds. Recall how you voted for this bill. If you have any questions, let me know. I'll be glad to answer them. But please, this is more than just a bill that you pass, and it's not going to affect people in a negative way. And it's not going to help the intended target. So please remember that when you place your vote. Thank you.